Well, hi everyone. My name is Beth Burry. I'm a Senior Vice President of Clinically Integrated Services at Sedgwick, and I oversee our case management, behavioral health, and return to work programs. And I've got Mark Divas here with me today. Hi, Mark.
Hi.
We're going to talk a little bit about essential workers and the pandemic today. And Mark and I have a lot of conversations in the course of our work at Sedgwick. Mark, if you want to tell everybody a little bit about what it is that you do from a behavioral health perspective.
Sure. Thanks, Beth. Yeah, as Beth mentioned, my name is Mark Divas, and I'm the behavioral health team lead with Sedgwick. So I oversee a team that works with our managed care unit, and we approach claims on a consultation basis, and we do work with injured workers, oftentimes doing telephonic support and discussions and motivational conversations to help them have return to work barriers addressed, and we try to work with them very closely to uncover what those barriers might be from a social work perspective, as well as mental health perspective, and oftentimes. And then we work as a team to try to uncover those barriers and address them and conquer them in a lot of cases. So our team works a lot with physical injury cases, but we do a lot with accepted files as well. So if there's been a psychiatric trauma, maybe there are concerns about PTSD because of the situation at work. Lately, we're seeing a lot of COVID cases, a lot of COVID stress cases come up, and so we're getting very involved in those as well. So that's a little bit about my background and what I do here.
Yeah, well, thanks, Mark. I think that really sets the framework for what we wanted to talk about today in just what you said, that we are seeing many situations in which injured workers, employees are having really intense stress and challenges within the work environment today. And to kind of tee this up, I was doing some reading, and there's a report that was filed by the Kaiser Family Foundation, which publishes on health-related issues back in May of 2020. So this was really early on in the pandemic, and essentially it said that a third of employees considered themselves to be essential workers at that point in time. And then they took it a step further, and when they compared non-essential workers, so those that were not within the industries that we normally hear about, retail, grocery, hospitals, pharmacy, you name it, those that are supporting us through all of this in person, that don't have an opportunity to necessarily work from home, but as compared to essential workers, we see a significant proportion of those that had life disruptions, income challenges, so financial and housing stressors, and a much higher percentage of essential workers knew someone who had already died of COVID even back in May. So you can imagine what that number must look like now. This obviously, Mark, we talked about how this has impacted our injured workers and the employees of our clients, but I think, too, feeding into that, the constant news cycle of information or maybe lack of information has also created a lot of stress. So I'm sure you and your team are seeing many of these things play out in the employees that you're contacting on a daily basis, social media certainly. But what would you say are some of the biggest challenges that essential workers are facing right now due to this whirl of communication and information in their environment?
Well, it's interesting you bring up the whirl of communication, because it's hard to talk about this without talking about this overwhelming gaslighting that's happening. You see this with trauma victims, just in general psych practice. You see this with trauma victims where the perpetrators will try to change the reality that this person is experiencing in order to deny their own involvement in that, or their own culpability in victimizing somebody. And so you'll see this a lot in that area. I'm seeing a similar pattern here with just a lot of misinformation about COVID, not even just the COVID transmissions, but sometimes just the existence of COVID in this country. I mean, it's amazing to me that, politically, and I don't want to touch too much on politics, but there is some things, even in the media, that leads a lot of people to believe that this is a hoax. And we saw a lot more in the summer, but now even, now we're in March and people are still kind of denying its existence. And now you've got some of the misinformation about the vaccines and how effective they are and what you can do now that you've been vaccinated, and people are starting to challenge this all over again with that. So I think over time, that disconnect that loved ones have with each other and employees have with their employers and coworkers have among each other, and then also with essential workers, you're dealing with the public who often has a very different view than you do, and also a very different source of their information than you do. And so
and
I think the big piece of that
too, I think factors in as well. I mean, they're there on the front lines every day. Yeah.
Right. And so they're gonna see it much more clearly than someone who isn't. I mean, I was talking to some colleagues here, and just over the phone when we're dealing with people. I mean, we're hearing time and time again people losing their lives from this or having really serious complications related to COVID infection. I mean, just a little self-disclosure here. Me personally, I've known several people who've died from this, and to hear that people are still denying that it exists is just kind of demoralizing in some ways, and also just
certainly compounds the stress that we're feeling.
Yeah,
absolutely.
Right.
Yeah.
And I'm not on the front lines, and so I can imagine dealing with a public that doesn't believe in wearing something as simple as wearing a mask, and the benefits of that, and challenging that to you're really kind of challenging an employee's sense of safety in their job, and they need some support in that area. And how do you deal with that? So some of the big challenges
it's
we're going to see, like emotional.
I was going to say, I think that the interesting part of this is that it's not something that we're prepared for. And so that compounding of that stress and isolation and quarantining, it really leaves a lot of people at risk for mental health issues.
It does. And we're starting to see, now that we're coming up on almost a year of this, we're starting to see a lot of the similar effects that you saw after 9/11, or maybe during the AIDS crisis, or maybe after Hurricane Katrina, where the people that are on the front line, months later are starting to develop this almost like repetitive stress reactions that lead to, in some cases, things like PTSD, or certainly adjustment reactions with anxiety or with depression. A lot of those things are starting to come up now, and we're seeing that more and more. And not just people that are essential workers. I mean, this is something that's affecting a lot of people, even who are secondarily essential workers, who are supporting essential workers, but are also exposed to the same risks in some ways. And just this compound collective trauma that a lot of people are experiencing is really leading to some pretty severe mental health reactions.
Absolutely. And I know, you and I have talked a lot about that compounding trauma or cumulative trauma that folks are experiencing because the pandemic has continued on and on and on. And it was, interesting. You had shared a presentation that you sat in on a couple weeks ago, in which there was some research that was cited regarding pandemic-related mental health risks amongst frontline personnel. And so this was, specific to hospital workers, emergency responders, but really important information, I think, for us to grasp that, in the study, they were assessing mental health problems, including traumatic stress, depression, anxiety, excessive alcohol use, and insomnia. And, roughly 15 to 30% of respondents screened positive for each disorder, which is something that is, unbelievable, really. And I think that it just goes to show how much this acute traumatic stress has really turned into accumulative stress. And we've kind of compared it almost to that fight or flight feeling that you get, except this is constant for them. So, yeah, and again, it's incredible to imagine how this is going to continue to impact essential and frontline workers going forward. So what might you say in terms of how we're able to help essential workers cope with this amount of stress? What seems to be some strategies that you and your group have been using during this time?
Yeah, it's a really good question. And we do talk about the term resilience a lot. And sometimes it's important to really focus on resilience on a personal basis. You know, what are things that the individual can do who is experiencing a life-changing event? And in this case, sort of an ongoing life-changing event with a lot of different parts to it. And a lot of them are moving parts, and a lot of them are unpredictable. And, you know, it impacts a lot of their daily lives, you know, whether it's, you know, homeschooling their kids, even dealing with family members struggling with health issues, to grief and loss, to trying to protect your own self and your own family. I mean, the stakes are really high, and it's impacting a lot of different areas. And so we talk about a lot with just resilience, like what are some things that you can do to take care of yourself? And I think the big thing that really comes up almost across the board is this feeling of, and I used this term before, doom scrolling, where you get sort of sucked into this media consumption that is ever bleak. And it's easy to lose hours and hours and hours just engaging in social media or engaging in news reading. And one thing that we suggest to people is set a time limit on that. I mean, it's really important to set a healthy time limit on that. You don't need to read the news for more than 30 minutes a day. There's not a whole lot that's going to be changing. And there's a lot of information that you can get in 30 minutes or 25 minutes or whatever seems reasonable to you. Maybe even have a blackout day where you're not engaging in the news. The same thing goes with social media, because a lot of social media consumption can feel really addictive to people. And especially since a lot of us are feeling isolated because of COVID and we're not gathering with friends and family, we're turning to social media. But it also can be very challenging as well, and very stressful, and oftentimes very time consuming. So it's important to kind of limit some of your social media connections if you can. Focus on connecting with people that are meaningful to you, not just the general public. You know, focus on, you know, spending time with your loved ones if you can. Turn to people that you trust and love and who care for you, and who ask about how you're doing and really understand your history. And can provide you with emotional support. So it's really important to lean into whatever your support system is if you have one. And if you don't, then maybe you're going to be doing some Zoom calls with distant friends and developing friendships that way, or deepening friendships that way, if it's possible. But it's important that you limit some consumption, put some good boundaries in your life, and then really engage in things that are going to be emotionally nurturing for you and supportive for you. All of those things are good steps toward resilience. There's a lot of other things like nutrition and sleep and exercise that, you know, frankly, when you're in a pandemic, you just don't have a lot of energy or focus to you know, uproot your life and change all of your patterns. You know, I mean, how realistic is that? But there are definitely some things that you can control and you can focus on. You can make some differences right now to help manage your stress. So that's our first step that we're working with people on.
Yeah, I was going to say, you bring up a good point, because I think that, you know, for those that feel that they can have some control over their circumstances, I think developing the idea that, you know, I can take some control back. I can make some decisions about what is going to be helpful for me in my environment. But then, you know, you and I have talked a bit about the fact that sometimes that's just not something that's easily accessible, or, you feel very out of control because you're an essential worker or you're on the front line and you're providing care for those with COVID. And then the tables kind of turn, and then we have to ask, well, then if everything is feeling like without your bounds of control, how do employers then engage their employees to make sure they are supporting them from an external source to ensure that they're leading with proactive approaches and advocacy? What are some things that you've seen that you think employers should be maybe engaging in right now?
Well, that's the big question, right? And I think in general, you'll see sort of across the board different employers doing different things. I believe the ones that are most successful are the ones that are really leading with empathy, that really lead with trying to understand the emotional circumstances that your employees are in, who take the extra time, who can communicate that empathy to their employees. Don't tiptoe around this. I mean, this is something that we know is impacting everybody, and especially essential workers right now. And employers that ignore that fact, I think, do so at great peril to their employees, but also their bottom line. And I think it's important that you need to communicate. And I use this term, communicate. I mean, you need to provide some good, reliable information that's fact-based. If you are talking about safety protocols, then back it up with where'd you get your sources? Where are you getting this information? Is it from a blog? Is it from the CDC? Those types of things are really important for people to know. And then you need to back up your employees with strategies on how do you handle interacting with the public who may be pushing back on you. What is the employer doing to support their employees during those situations? Ironically, we're seeing a lot more of that now with the vaccine rollout, that people are kind of acting a little nutty again when they're interacting with people who were there to administer a vaccine, and not realizing that those employees who were administering the vaccines often didn't get the vaccine until just the day before, and have to then come up with 16,000 doses in a very short period of time, and they're working extremely long hours to do that, and then have to work extremely long hours the next day to administer them, all in a short period of time. So it's always like this sort of emergency crunch time, and then this lull until the next shipment comes in. And so it's just extremely stressful for people. I think employers, should also be aware that that's taking its toll on your folks, and how can you be flexible within whatever your parameters are, reasonable, but maybe, going a little bit outside of your parameters to provide some level of flexibility to your employees so they know and they feel supported. And then you're looking at some other things like, boosting utilization of their mental health resources, whether that is an employee assistance program, maybe it's a Zoom group that you're setting up that people can discuss safely about, just emotional things. A lot of grief happens in healthcare settings because of death and struggles. There's a lot of grief needs of employees that are going through this. But even, essential workers like grocery store employees, some of their colleagues are dying, or they know people who've died, and it's going to impact them. And so if you could address some of the emotional needs that as well, I think that's going to go a long way. It's not going to be an on-site debriefing that you would normally see in normal days, but it could be something through a Zoom support thing, or maybe some hotline that they can call to ask for support, or maybe talk to a counselor. So.
Yeah, I mean, that's a great point there, because, it need not be something where the employee necessarily has to reach out and say, I need help, but rather if the employer has the ability to check in and say, how are you? Do you need some assistance here? Let's offer something up, because a lot of times people aren't going to necessarily reach out and say, I need help, but when it's proactively approached, they're more likely to engage. So Well, yeah, Mark, this has been great. As we wrap up, I mean, I've always said we could talk about this for forever.
I know.
It's such an important topic. But as we wrap up today, I mean, what would be one of the final things you'd say to employers as we're still navigating through the pandemic and vaccines and trying to get to the other side of this?
You know, key thing, lead with empathy if you can, and really focus on the emotional toll that this is taking on your workers. That's important, and convey that to them. I mean, it's one thing to just get it, but then it's another thing to let them know you get that. That goes a long way toward fostering trust, and will help with retention, and will help diffuse a lot of things. So I think if you can lead with empathy, that's my big takeaway. It's a complicated concept, but I think it's a very important one.
Yeah. Well, great. Well, thanks again, Mark. It's good to see you over Zoom, and hopefully we'll be able to see each other again in person sometime. But yeah, absolutely. Well, thanks very much, and it's been a pleasure.
Yeah. Thank you, everyone.